I'm going to take a little bit different approach to this. I think that regardless of what you think about the PPACA legislation in the Supreme Court, I'll give you one statistic that I think will clearly demonstrate where I'm coming from and our organization's coming from. In the state of Louisiana in 2014, the reinsurance fees and the excise taxes as a result of this legislation will cost our organization over $60 million. Is that addressing affordability? You know where that's going. It's going to have to be passed along. So let's just talk about what's going to happen. That's the approach I want to take. Talk about what's going to happen between now and 2014. Regardless of what happens, I think we're in a no-throwaway situation. The things that we're doing, 95% of which we won't throw away regardless of what happens in the Supreme Court. The reason being is that we must address affordability. If you think about the economic pressures that have been brought to bear over the last 2 decades, those economic pressures are as a result of businesses saying that if we don't fix health care, it's going to impact jobs. It's going to impact my ability to meet my margin needs as an organization. 20+ years we've been hearing that message, and we've been nibbling around the edges. When we started this business over 30 years ago, we being myself and my family, the GDP, the healthcare costs represented close to 7% of GDP. Today it's 17%. And we're just a breath away from that moving to 20%. There's an article that's been recently written that by 2034, that the cost of health care will exceed annual household income. Game over. So we know something has to change. I mean, this is a serious situation. So let's take a look at the problem. Here's the continuum right here. 5% of the population gobble up 50% of the care and the dollars. 5% gobble up 50%. 50% gobble up 5%. And then you have the people in the middle. To put that in dollar terms, the 50% of the people down here in the lower end spend about $450 a year in health care expenses. The other end, $77,000 a year. Big disparity. What's our opportunity? Our opportunity is to better manage the chronic care on this end and to stop moving Americans into that chronic condition. So for us to build a healthcare delivery system, not a model, we pretty much have to look at the past in order to predict the future. So let's talk a little bit about the past. What got us here today? There's something pretty controversial out there that's really driving that 5%. End-of-life care and beginning-of-life care. Who wants to talk about that one? I don't. Now, I've had a discussion with my physician and my family, and we certainly know that end-of-life care, what my desire is. But I'll tell you, that's something that has to be addressed. That's huge. Next thing, this volume-based system that we all are in today. Every time you go, we pay. We pay. You're not paid based upon quality. You're not paid based upon outcomes. Based upon volume. The more diagnostic tests you have in your office, the more tests that are run, the more office visits, the more money it's paid out. That's got to change. Consumer accountability. That's got to change. United Healthcare has a wonderful TV ad out right now. Know your numbers. We have to be more accountable. Healthcare reform starts at home. What are my cholesterol levels? What are the sugar levels? What's my blood pressure? What are the things that I can do to help better manage healthcare expenses? 72% of disease is preventable. How are we going to fix healthcare? Why don't we try to address 72% of the disease that's preventable, that we can have an impact on? And then we'll put a better model together. Here are a couple of real challenges for us, cultural challenges. Think about this one. That's the toughest way to move a needle, culturally. Well, I have a friend of mine that called me last week. He said, Mike, I need a gastroenterologist. My wife, the last couple of nights, she's come to the dinner table. She's got indigestion. He said, I need a good gastroenterologist because I want an upper GI done. Well, now we've gone to picking out who the specialist is, and not only who the specialist is, what the tests are that's going to be run. Are we a bunch of MIT graduates or what when it comes to health care? That's got to change. That's going to have to change. We're also a society of instant gratification, right? Give me a pill, I need to feel better. Give me a shot, I'm sick. If I drink this Gatorade, I'm going to play basketball like Michael Jordan. I mean, we just feel like it has to happen now. So I want immediate access to care. Not, well, let's take a look at what some of the drivers are that are causing those health conditions. Let's take a look at your sugar levels. No, I want to be fixed right now. So we have a number of challenges. I think that if we look in the past, look in the rearview mirror, it's going to help us predict the future. What's the future? Well, we're beginning right now, and we have installed already a couple in the state of Louisiana, patient-centered medical home. It's not a house, it's not bricks and mortars. It's a reintroduction of primary care. It's a reinvestment in primary care. It's getting the marketplace thinking, I need to turn health care over to someone who really knows health care. And quit trying to self-diagnose and determine direct to specialists what my needs are as an individual. The roles and responsibilities of the insurance industry is clear. We're going to continue to take risk. We're going to continue to aggregate membership and develop rates, but our role is changing a little bit, away from answering the telephone and paying claims. We've got to be advocates for our customers. We have to be coaches. We have to motivate. We have to get individuals to understand the need to get re-engaged in primary care. We're going to create a data source that will link data back and forth from the provider with interoperable health information technology that'll put us all in a better place of giving the right care at the right time in the right place. Now, the providers, on the other hand, the primary care providers, because we're hearing about this shortage of physicians, they're going to have to begin to embrace nurse practitioners, physician's assistants. We're going to have to find ways to better triage basic primary care and allow the primary care physicians to practice, quote, at the top of their license. Let's make care more accessible. Let's keep people out of the emergency room. We have frequent flyers, people that go 40, 50 times to the emergency room a year. When you ask them who's their primary care physician, you know who they say? Yep, their ER doctor. That's not going to work. So you expand hours, you make more basic care available. And in the long run, we're going to find that we can begin to address some of these drivers in care. And the members have to be more accountable. They have to embrace change. In summary, don't be afraid of change. Gravitate to it. Look for ways. Look for the opportunities that the system presents each and every day for us to find ways to improve our own health. Because right now, a generation of children are being diagnosed with adult onset diabetes. Did you get that? 10 years old, adult onset diabetes. They're not adults. We've got to change the name of the disease. So we need leadership. We need to step up and find ways that we can begin to engage more accountability in the marketplace. I know we can do it. Every bit of effort, all the willpower in the world is going to be focused on this movement in the future. We're going to embrace primary care. And I think we're going to see that a movement away from the past and a movement to the future is certainly going to pay huge dividends for us. I thank you very much for your time and attention. Appreciate it. Look forward to the panel.
Well, we're